Hi everyone, and thank you for joining me. My name's Dhalia Masud and I'm a plastic and reconstructive surgeon, and today we're going to be talking about facial rejuvenation. But instead of focusing on non-surgical treatments like Botox and fillers, I want to take you inside the world of surgical options you can actually have done while awake under local anaesthetic. So no full facelifts, no hospital stay, and far less downtime. It's a halfway house for those that don't like the idea of a full facelift and would like to explore something less involving. So why are these options important? A traditional deep plane facelift takes about 3 to 5 hours in a hospital with weeks of recovery and a significant price tag. Not everyone has the time or wants that level of involvement. But at the same time, a lot of people want something more longer lasting than Botox and fillers, and that's where these procedures can come in. A kind of a halfway house between injectables and facelifts, but you do need to understand the pros and cons and the effectiveness of these things before you go down this route. Now, it's really important to say not everyone will be suitable for these procedures, and it may not be effective for everyone. The best next step is to have a proper consultation and a facial assessment. That way you'll get a clear picture of what will benefit you and what you can realistically expect. Remember, even with lighter surgical options, we always need to weigh up the risks and expectations. So let's talk about what can actually be done under local anaesthetic. I'm going to be talking about a few things to open up the discussion. We generally look at the face in thirds, and different people like to focus on different parts of the face. Now, if we talk about the upper third, where we're looking at the eyelids and the temple, some people, this is their main focal point. It makes them look that little bit tired. The side of the eyes have dropped. And two things that can be done under local anaesthetic are upper eyelid skin excision or a blepharoplasty. And this will open up the eyes. And this can also be done as a day case under local anaesthetic. The other thing that can be done at the same time or in conjunction with the upper eyelid surgery is a temple lift. Now, some people think they need an upper eyelid lift, but actually is a lift of the temple, and that can open up the eyes. And this can also be done under local anaesthetic, and it can make a huge difference. It gives a refreshed look and leaves a very discreet scar in the hairline. The next thing we can look at is your mid-face. Now, if some people have laxity in the mid-face region, and again, they don't want to go for a full facelift, a gentle lift in the mid-face region can give you a refreshed look. Now, the difference between a mid-facelift and a full facelift is the amount of skin lifting on the face. When you have a general anaesthetic full facelift, we have the ability to separate the layers of skin and muscle a lot further into the face region to give us a more pull that reaches all the way, or that reaches a little bit further. Under local anaesthetic, we're unable to do this. So we wouldn't lift as far forward into the face. We would have more of a conservative lift. We do have access to the muscle, and we will be able to tighten it. It will be a gentle tightening of the underlying muscle without further raising the underlying muscle. So the lift and tightening is still present, but it's not as extensive as what you would have had if you had a full facelift. This is ideal for patients where it's not medically appropriate for them to have such a long general anaesthetic, and also they don't want something too involving. You may be in your 60s or 70s, and this is something that will just give you a bit of a refreshed look. It doesn't have the same long-term effects of a full facelift, but it will give you some improvement, particularly in the recent years to come. It creates a subtle, natural, and refreshed look. The scars appear similar to a full facelift, which will be in front of the ears going just below the earlobe. At the same time of both of these upper and mid-face lifts, we would remove the excess skin and refine the mid-face, and also we can extend it into the jawline. Now, these procedures can be done in clinic and you can go home at the same day. The main aftercare is you need to sleep upright for about 48 to 72 hours. Avoid any heavy lifting and bending over. And like any surgery, there's always a chance of infection, bleeding, and lumpy scarring. There are other things that we can do to open up or refresh the face, and that includes a lip lift, leaving you with a hidden scar underneath the nose. Now, with these local anaesthetic procedures, they don't last as long as a full facelift. A deep plain facelift can last between 8 to 15 years depending on your health, your skin quality, your age, and how you take care of yourself. But the local anaesthetic lifts don't last quite as long, but with good skincare, healthy habits, and non-surgical maintenance, results can hold up beautifully. Now, some people may not be medically suitable for a long general anaesthetic. So these kind of procedures are ideal for patients that are unable to have a general anaesthetic, or they don't really want to have such an involved procedure. But it is imperative to understand they do not last as long as a full facelift. In a previous video, we discussed the difference between facelift and improving the skin quality. So all these lifts generally lift the face. We don't improve the quality of the skin, and we're not adding volume. And sometimes it's the lack of volume and the poor skin quality that contributes to the tired look. So what can we do under local anaesthetic that can be effective in improving these aspects? Number one is fat grafting. Fat grafting is perfect for deep lines around the mouth and in the forehead, even where facelifts struggle. And a lot of surgeons do fat grafting at the same time as a full facelift, and I do that also. However, this can also be done under local anaesthetic, either at the same time as a lift that we've already discussed, or in an isolated procedure on their own. And if you want to target deep lines around the mouth or in the forehead, and you are very specific about the lines that you want to target, this is ideal. There are other skin treatments that we can do in conjunction, and that includes a chemical peel that takes off the top layer of skin and helps create new, fresher skin to improve and give you a more rejuvenated look. Other regular forms of treatment that we can do to improve the quality of your skin are PRP injections, and that is platelet-rich protein or platelet-rich plasma from your own blood. And this can help boost the skin quality either before or after surgery. Ideally, I would recommend PRP injections once every 6 months to a year to help maintain the rejuvenated look. So just to recap, when it comes to local anaesthetic procedures to rejuvenate the face, we look at the face in thirds. In the top third, we can do a temple lift and upper eyelid skin excision. In the middle third of the face, we can do skin lifts with a bit of muscle tightening, and this can be extended into the jawline. And these all lift the skin and also the muscle to some extent. But it's really important to understand that they are not as involving, and at the same time, they're not as long-term or long-lasting as a full facelift. The other things that we can do under local anaesthetic to increase volume and to help rejuvenate the skin are fat grafting to help isolated areas of lines that you really want to target, and also skin peels as well as PRP injections to help rejuvenate the skin. So if you're looking for something more permanent than Botox and fillers, but you don't want to commit to a full facelift, these are the options under local anaesthetic. Just remember, they're not for everyone, and the key is to have a one-to-one discussion with a plastic surgeon to see what's right for you. I hope you found this useful, and if you did, please hit the subscribe button and let me know in the comments what topics you'd like me to cover next. I can go over a few more procedures that you're interested in. Thanks for watching, and I will see you in the next video.